Good evening with Haryanto Diman. I'm Olivia Koy and we're coming to you live from the Straits Times newsroom.
A short time ago, the Multi-Ministry COVID-19 Task Force announced major updates to Singapore's vaccination program and strategy.
First up, from tomorrow, Wednesday, May the 19th, those aged 40 to 44 can register for their vaccination. If you're in that category, you can register only online via vaccine.gov.sg. Starting with this group, the exercise will continue to be progressively rolled out in 5-year age bands.
Also announced today, the Health Sciences Authority has authorized the use of the Pfizer vaccine for children between 12 and 15 years old. It's the first COVID-19 vaccine authorized for use here for this age group. The Health Ministry will work with the Education Ministry on the vaccination details and provide further updates in due course.
The task force also announced that the interval between the first and second vaccine doses will be extended to 6 to 8 weeks. This is up from the current 3 to 4 weeks and will apply to vaccination registrations from tomorrow.
Endpoint is actually the same. The difference is that we are trying to, instead of having a good number of people getting maximum protection, we make sure we get the maximum number of people get good protection.
This decision was in consultation with the Expert Committee on COVID-19 Vaccination, in line with global data from clinical trials.
It's also based on similar rollout periods in countries like the UK and Germany.
I understand even within the UK, some discussion still continues, and there is some thinking that they may want to shorten the interval from where it is right now, moving it down even from 12 to 8 weeks. So across different jurisdictions, different countries, we seem to be coming to some form of agreement independently that it is acceptable to lengthen the dosing interval, but it would probably be somewhere around the region of 6 to 8 weeks, which would be reasonable for us to anchor on at the onset, allow for a good balance between providing more first doses, but also making sure that that we don't have that second dose kept too long away. Therefore, that those who receive their first dose then can still consolidate their immune response with that second dose to amplify the benefit from the first vaccination.
Those who have already booked their appointments for their second dose will not be affected, but they can volunteer to postpone it and for the dose to be given to someone else.
To facilitate the vaccination of homebound people unable to travel to a vaccination site, MOH is working with the Health Promotion Board and Agency for Integrated Care to deploy home vaccination teams. These teams will comprise a doctor and a nurse.
Meanwhile, the task force has also updated its guidance on masks as recent clusters suggest a higher level of transmission likely attributed to new virus variants.
It's urging everyone to choose masks with good filtration capability, including surgical masks and reusable masks made of at least 2 layers of fabric.
There is nothing wrong with the current mask being used, but what we are saying is based on the latest evidence of the new strains being more transmissible and the possibilities of aerosolized transmission. That simply means that the mask that you wear for protection ought to be of higher filtration capabilities. And that would mean wearing either a surgical mask or a reusable mask that is made of at least 2 layers of fabric. These would include masks that have been issued by the People's Association and Temasek Foundation. They have good filtration efficiency. But if you were just to take a simple piece of cloth and cover your mouth, that kind of a cloth mask may not have the same filtration capability and protective effect as a mask that has a higher level of filtration capability, like a surgical mask or one of these higher quality reusable masks.
Visit straitstimes.com for more details on today's press conference. You can also watch the full press conference on our YouTube channel later tonight.
And remember to subscribe by hitting the red button below. I'm Haryanto Diman. With Olivia Quay, stay safe everyone.